GlucorolSX was designed for the patient with metabolic syndrome or type 2 diabetes in mind. Some of the major components in GlucorolSX work directly to lower fasting blood glucose and HbA1c, and also to offset the damages of having high blood sugar. Another action of the product is that it actually helps insulin resistance, and the idea of insulin resistance is that your cells are not accepting the signal of insulin in your body so that you can process your glucose properly. Berberine hydrochloride is one of the most important ingredients in this product, and berberine hydrochloride has studies that are head-to-head against some of the large pharmaceutical drugs that are typically prescribed for this condition, one being metformin. There's a study that shows berberine is nearly as effective as metformin in reducing fasting blood glucose and HbA1c, but berberine had a side effect that was actually beneficial. It improved liver function. So not only can berberine lower fasting blood glucose and HbA1c, it improves liver function, and it also reduces cholesterol and triglycerides. Another major component in this product is lipoic acid. Lipoic acid is actually prescribed in Europe as a treatment for type 2 diabetic neuropathies. So that's resulting from very high blood sugar causing microvascular damage, which is why sometimes there's amputations or there's blindness caused by diabetes. It's because of the oxidative stress caused by the high blood glucose. The lipoic acid is one of the most potent antioxidants that's known, and it works by recharging vitamin C, vitamin E, which are fat-soluble and water-soluble, but it also recharges the major antioxidant of the liver, which is glutathione. Lipoic acid is very potent as an antioxidant, and it's used in that fashion, but it also helps with the component of insulin resistance by unlocking the cell, essentially allowing the signal of insulin to penetrate the cells so that the cells can properly utilize glucose. Another component that helps with that is chromium. Your molecules need 4 chromium particles in order to activate and accept glucose as well, so chromium is very well studied, and diabetics actually have a pronounced deficiency in chromium typically. Some other major components are cinnamon. Cinnamon has components like methyl hydroxycalcone that actually mimic insulin. Cinnamon is an antioxidant as well. Vanadium also helps to unlock the cell on that insulin resistance portion of it, very potent for patients that have problems with simply metabolic syndrome. Diabetes is a disease that's a progressive disease. The metabolic syndrome is typically there for years and years before it actually manifests in frank diabetes or type 2 diabetes. And so these components will help prevent that from happening, and also treatment for people that actually have the disease.